Today we're diving into the complex world of heart transplantation. Sounds dramatic, right?
Absolutely. It's one of those medical procedures that feels almost sci-fi, but it's saving real lives every day.
Yeah, and I think people often forget how recent heart transplantation is in medical history. The first successful one was in 1967.
That's true. It was Dr. Christian Barnard in South Africa. Imagine the courage it took to attempt that.
And the risks involved. Back then, rejection was a huge issue. The immune system just didn't play nice.
Right. Even now, rejection is still a big challenge, but immunosuppressive drugs have changed the game.
Those drugs are a double-edged sword, though. They help prevent rejection, but can leave patients open to infections.
Exactly. It's a constant balancing act. And the wait for a donor heart can be agonizing for patients.
The shortage of donor hearts is a huge problem. Some people wait months or even years.
And sadly, not everyone makes it to transplant day. The demand far outweighs the supply.
That's why there's so much research into artificial hearts and devices like LVADs.
LVADs, left ventricular assist devices, are like mechanical pumps, right? They can keep patients alive while they wait.
Yes, they're amazing, but not a permanent solution. They're like a bridge, not the destination.
It's fascinating how the selection process works. Not everyone is eligible for a heart transplant.
There are strict criteria: age, overall health, lifestyle factors. It's not just about needing a new heart.
And psychological evaluation too. Patients need to handle the stress and demands post-surgery.
Speaking of demands, the post-op recovery is intense. Lifelong medication, constant monitoring.
And regular biopsies to check for rejection. That's no walk in the park.
Not to mention dietary restrictions and lifestyle changes. It's a whole new way of living.
I read that survival rates have improved a lot. Many patients live 10 years or more after transplant.
Yes, some even go back to work, travel, or take up new hobbies. It's not just survival, it's quality of life.
But it's never back to normal exactly. The threat of rejection or complications is always there.
True, it's like living with a storm cloud that might or might not rain.
Still, the gratitude from recipients is immense. Many call it a second chance at life.
That's powerful, but it also comes with survivor's guilt for some patients.
Right, knowing their new heart once belonged to someone else is emotionally complex.
The donor families are heroes too, consenting to donate at such a tough time.
Absolutely. Their generosity creates hope from tragedy.
I wonder, do you think there's enough public awareness about organ donation?
Good question. I think there's more than before, but misconceptions still exist.
Some people fear doctors won't try to save them if they're donors, which isn't true.
Exactly. Medical teams always prioritize saving lives first. Donation comes later.
Cultural beliefs also play a role. In some places, organ donation isn't widely accepted.
Education is key. The more people know, the more likely they are to register as donors.
I agree. Every registered donor could potentially save multiple lives, not just one.
Heart transplantation is a miracle, but it's built on science, ethics, and deep emotions.
And it's not just about the heart. It's about hope, resilience, and community.
The teamwork in the operating room is impressive. Surgeons, nurses, anesthesiologists, all working together.
Like a well-choreographed dance, but with higher stakes than any stage performance.
Definitely. And technology keeps pushing the boundaries. Who knows what's next?
Maybe one day lab-grown hearts will become reality. Science fiction, but edging closer.
That would solve the donor shortage overnight. But until then, we rely on generosity and innovation.
It's inspiring how far medicine has come. 50 years ago, this was unthinkable.
Now it's a beacon of hope for thousands every year.
Yet, it's sobering to remember not everyone gets that second chance.
That's why advocacy and awareness matter. Every voice counts.
If you could ask a transplant recipient one thing, what would it be?
I'd ask how their perspective on life changed after surgery.
That's deep. I bet their answers would be profound.
Probably. Facing mortality tends to shift priorities.
It puts our everyday complaints into perspective, doesn't it?
Totally. Suddenly, traffic jams seem pretty minor.
So, as we wrap up, what's the key takeaway about heart transplantation for you?
For me, it's a story of human resilience and the incredible potential of science.
And I'd add, it's a call for all of us to consider organ donation. You never know whose life you might save.
Absolutely. Maybe today's talk will inspire someone to sign up.
Here's hoping, and for anyone waiting for a transplant, we're rooting for you.
Stay strong, and may science keep bringing miracles.
Thanks for listening. Until next time, keep your hearts open.
And keep your curiosity alive. Bye for now.